Welcome to the role of cleaning in controlling infections. The role of cleaning any type of facility is to reduce the number of microbes, harmful germs, that may be present on surfaces. Cleaning procedures are important to minimize the risk of transferring harmful germs from one surface to another, or from one person or object to another, thereby reducing the risk of infections. This is known as cross-contamination. Failure to implement adequate procedures to minimize the risk of cross-contamination present the greatest challenge to cleaning companies and their staff. In this section, you'll learn about the following: an introduction to microbes or germs, how germs enter the body, cleaning and disinfection, and applying cleaning and disinfection procedures. A microbe is a term used to describe tiny organisms, referred to in this course as germs, that individually are too small to be seen with your eyes. Germs include bacteria, fungi, and viruses as the most common types of harmful germs. Germs are everywhere. There are more germs on your hands than there are people on the entire planet. Germs are in the air we breathe, the ground we walk on, and the food we eat. They're even inside of us. Most germs in our world perform important functions that help us in many ways. Unfortunately, though, some germs can be dangerous and cause disease. We refer to these dangerous microbes or dangerous microorganisms as harmful germs throughout this course. Many human illnesses are caused by harmful germs, disease-causing bacteria and viruses. To cause disease, these harmful germs must find a way to enter your body. The most common ways to enter the body are from cuts and grazes exposing open sores, needle stick injuries, contaminated food or water, close contact with an infected person, contact with the feces of an infected person, breathing in exhaled droplets when an infected person coughs or sneezes, or indirectly by touching contaminated surfaces such as taps, toilet handles, door handles, bar tops, ATM machines, toys, and baby nappies. And that's the point of this course. Cleaning with simple soap and water kills some germs, but more importantly, our daily cleaning procedures are designed to reduce the level of germs to a safe level. When cleaning, the objective is to reduce the number of germs and by doing so, keep everyone in the building healthy. However, if we don't clean properly, we will fail to remove germs and we may actually spread an infection and make more people sick. Using dirty cleaning equipment, and in particular dirty cleaning cloths and dirty mops and buckets, can spread harmful germs from one surface or room to another surface or room. If you're not careful, your cleaning procedures could be the cause of a major infection outbreak, resulting in many people getting sick and some people dying. You can reduce the spread of harmful germs by changing your cleaning cloths regularly and wash them at the end of each shift, changing your mops and change your bucket water regularly. Rinsing cleaning cloths and mops between rooms will not remove harmful bacteria. Some facilities, such as healthcare and aged care, require cleaning cloths and mops to be washed each day after use. Some places, such as hospitals and medical facilities, have detailed procedures to prevent the spread of infections. The role of cleaning is to reduce the number of harmful germs that may be present on surfaces and minimize the risk of transfer of harmful germs from one person or thing to another, thereby reducing the risk of infection. Cleaning is a process which removes soil, for example, dust, soil, food and beverage residues, from a surface or an object through the use of water, detergent and mechanical action or friction, that is using a cleaning cloth or a mop and a bucket or some other type of cleaning machinery. Although cleaning is known to successfully reduce the number of harmful germs on surfaces, there are some circumstances where a disinfectant is also required. This is particularly important where harmful germs are present, and in particular harmful germs which are contagious. That is, they can easily spread from one person to another. Disinfection is a process which kills or removes harmful germs from surfaces after the surface has been cleaned. To effectively kill germs and make sure the disinfectant works properly, we must firstly clean the surface with detergent to remove all the soil on the surface. All disinfectants take time to work. Most disinfectants take 10 minutes to kill germs. This means if you simply wipe a surface with the disinfectant, you won't kill all the germs. There are some situations where cleaning all surfaces is upgraded to cleaning and disinfection. This is particularly the case where there is a very high risk of transmission. That means spreading the harmful germs between surfaces and people. This type of cleaning is referred to as transmission-based precautions. There are 3 important factors which together help ensure cleaning and disinfection practices are of a high standard. These include using the right chemicals, the right equipment, and the right cleaning technique. All staff performing cleaning functions should be aware of the importance of each factor and how they affect both cleaning performance and the removal of harmful germs from surfaces. For example, if the cleaning chemicals and disinfectant are of the correct standard, but the cleaning equipment is dirty, for example, dirty cloths or mops, particularly if the cleaning equipment is not disinfected between cleaning tasks, staff can potentially spread harmful germs from one surface to another. The level of cleaning, including cleaning frequencies, types of cleaning agent, and the types of equipment will depend upon the type of building or place you are cleaning, the size of the area, and the number of people occupying or visiting the building. When cleaning any commercial building, including hospitality or hospitals, it is important to clean surfaces where people touch regularly. This is where they can transfer harmful germs from one person to another. We call these frequently touched surfaces high-touch surfaces. When cleaning any public area, it is important to remember these environments act as germ carriers for people to spread germs from themselves onto high-touch surfaces, which are then potentially transmitted to the next person or to the person who touches the contaminated surface. Can you think of any high-touch areas in your business or your office, your telephone, an ATM machine, the bar,